Did you know the saliva ejector you use every day may pose a potential risk of cross-contamination for your patients? Studies show that a backflow of fluids may occur over 20% of the time when the standard saliva ejector tips become occluded. That means if you treat 10 patients in any given day, at least 2 are at risk of contamination from backflow. It may be common for a patient to close their lips tightly around the saliva ejector tip, or for the saliva ejector to become blocked when placed under the tongue or close to the cheek. This blockage creates a temporary drop in vacuum pressure, which can cause backflow from the evacuation line into the patient's mouth, possibly exposing them to saliva, blood, and other potentially infectious materials from previous patients. Stop backflow in its tracks. Safe-Flo Saliva Ejectors and HVE products are not made with natural rubber latex and provide a built-in one-way valve that eliminates the backflow associated with your patients. Safe-Flo valves do not affect the suction or performance of the tip, and there is no need to change the way you work in order to protect your patients. Available in a complete saliva ejector valve system or as an adapter for use with standard saliva ejectors and HVE tips, Safe-Flo Saliva Ejectors and valves are effective, single-use disposables that prevent backflow. When the on-off low-volume vacuum valve is opened, the vacuum system draws air through the check valve in the tip. As this happens, the check valve opens in the direction of air and fluid flow and remains this way during operation. Once the suction is stopped or blocked, the check valve immediately closes to create a physical barrier that stops air and fluid from backflowing. Stop backflow in its tracks with Safe-Flo Saliva Ejector products from Hugh Freedy Group, the best in practice.